Hey everyone, I want to take a minute to go over the different techniques in hair transplantation that are available today. Now, when we talk about different techniques, we're really talking about different ways of harvesting hair. What do I mean by harvesting hair? In hair transplantation, we take hairs typically from the back and side of the scalp, and these are hairs that are very resilient. They don't tend to fall off and they tend to stay there for most of our lives. And we take these hairs and we transplant in other parts of the body, such as the top of the scalp, the temples, or the eyebrows, and even the beard area. Now, we have two common ways of removing the hairs from back here. Now, the first way, it's called the strip technique or the follicular unit transplantation. And it's the older way of doing it. It's been around for decades. The strip technique involves us removing a strip of hair about yay wide and yay long, and removing that, closing the defect that we created in the back of the scalp, and taking that strip and removing the hairs one by one and then transplanting them. The strip technique has benefits. One of the benefits is you can get a lot of hair out of it. And then one of the disadvantages is that it leaves a linear scar that's hidden if your hair is long back there, but if your hair is short, it's clearly visible. The newer techniques that are available today are techniques that are called Follicular Unit Extraction, or FUE. How is follicular unit extraction performed? It's done via typically a device that is a suction extractor. So it's a device that is able to identify those hairs, kind of burr through the skin a little bit, and remove those hairs individually. This results in an area that has little to no visible scar. To do this, we do have to shave the back of the head so we can identify those hairs one by one and remove them one by one. The main limitation to the follicular unit extraction is that it's a little bit longer of a procedure, and you can't get as much hair as you would with follicular unit transplantation. But typically, you can get enough to get what you need to do in every patient. So these are the two techniques, and they're both readily available. The follicular unit extraction has become more of a gold standard today than follicular unit transplantation, and it'll probably continue to be the main way of doing hair transplantation in the future. Thank you.